Hello, everyone. This is Charlie Barnes. Welcome to Hometown Healthcare. I'm here today with Katie Islam, who is a registered nurse and clinical transition liaison that actually works with us and for us. And she's a frontline worker in the world and has been for a long time. And today things are a little bit more interesting. So I'm happy to have her on just to discuss kind of what is going on out there in the world. And Katie, what you get to do is you get to spend time in kind of the hot spots, right? You get to be in the hospital. You get to be, and I think that's where you spend most of your time, if I'm not mistaken. I may be not completely right there, but just, kind of just share what's different today than it was 6 months ago.
Thank you, Charlie. It's so I do work inside a facility, a very large facility, with 3 separate towers down here in Gainesville, Florida. And it is definitely very different than it was 6 months ago. I used to stay in the hospital all day from about 8 to about 4:30, helping transition patients out of the hospital on 4 barns, on either IV infusion or respiratory services, enteral services, nutrition services. And in March, we kind of got pulled out of the hospitals. But as a frontline worker, I was allowed back in for that teaching. So I did a lot of work from home. However, I would go into the hospital usually 3-4 times a week to see patients. Then when we came back out of we're still in the pandemic, but when things got a little easier to deal with, I started to go back in, and so I'm in the hospital. I do see COVID patients. I do see actually all of Barnes's patients. Any patient that lands in the hospital for any reason, I follow through. My job is to basically help them transition from one place, from the hospital into a home setting safely with whatever services they have. I also consider myself a liaison to the case managers there. So even if Barnes can't provide something, I have a huge knowledge base of the home setting. So I help them with that transition to those patients as well. But it's definitely been very different. When I teach patients now, I have to wear sometimes 2 masks, a shield over my face. It's very difficult.
How does it work, right? So how do you breathe? Can you breathe? Can you talk?
No, you can't. And you're screaming through the mask. And while I'm trying to teach somebody how to go home on an IV infusion, it's very difficult. Yeah. You're out of breath. By the time you walk out, you feel like, you've been in a sauna because I'm all gowned up on top of all the PPE that we have. So it's been very challenging.
Are you wearing the face mask, or do you have some other kind of goggles or something? How are you do?
Normally, I don't wear glasses. I usually wear contacts, but I've resorted to wearing glasses now. And we do have a face shield that looks like a welder's mask over me. And I'll have an N95 mask and a mask over it for those patients. Yeah, not every patient has to be seen that way. But now, with the mask requirements, period, no matter where we go, we have a mask on and can't walk through the hospital without any mask on. So it's been very challenging.
How's the patient experience different? So you have somebody coming in, just give a scenario. So people may not understand also what infusion in the home, going home on an infusion in the home, it's kind of what that experience is different for them going through the hospital.
So, patients over the last 10 years, I'd say, have gone home sicker and sicker. They stay in the hospital less, which means we are doing things in the home that we did not do 10, 15 years ago at the level that we do now. So we send patients home. Sometimes, most of the time, it's an infection and they have to be on antibiotics for 4 to 6 weeks. And they're not going to be able to sit in a hospital setting for that time. So we teach them how to actually self-administer in the home, those IVs. And we work hand in hand with home health. So home health care picks them up on the home health side and sees them. So we really coordinate with them as well to ensure there are patients that don't qualify for home health. So they actually are doing the infusions by themselves in the home. But we have a lot of neat devices. They don't go home with IV poles and all that extra stuff. We have some really neat things that allow them, you know, the ability to move around their house and not tie them down, and actually healing in the home environment is a better opportunity, or better choice.
Really spending longer in the hospital, shorter in the hospitals, any of that changed?
I feel like they're shorter in the hospital than they were, just because you have the ability to do infusion in the home. They're also trying to get, because of COVID, nobody wants to come to the hospital. I had a patient today that is extremely sick and waited because they didn't want to come through the ER. So definitely getting them out quicker is a huge deal.
Oh, very good. So working with other clinicians in a hospital setting for you, has that become more challenging, or kind of how's that kind of clinical conversation? Has anything changed there?
No, I don't think, no, they're happy that we're getting them out quicker. You know, the discharges, it used to be you'd have a day or two they'd give you in advance. And now when we get a referral at noon, they want that patient out the door by about 4 or 5. So it's a lot of quick work.
You're having to hustle. It's not like you're running.
Having to hustle. That's exactly right. So, but you know, the patients are appreciative. I will say that coming up on a COVID patient, now that we're 6 months into the pandemic, now I'm finding patients that have actually recovered, but I still see the residuals just in their clinical status, which is kind of crazy. You think when you get sick that, you know, you get better, you have antibiotics and medications, and these patients I might not see for COVID, but I definitely see for other reasons. And that's an interesting piece to it.
Interesting. Are there any other perspectives or anything else to share as a registered nurse working in the hospital to home environment that may not be being talked about?
Well, the mask debate is actually being talked about, but you know, as a healthcare provider who has small children in the home, I have a daughter who has a significant medical history. It you know, for me to struggle with people not wearing masks is hard. And just because I see what happens in the hospital, you know, I see the patients, I see the floors where 13 employees are infected in a day. And people don't see that. They don't see that you can't come into the hospital setting because, you know, they don't allow visitors, or they only allow one visitor at the time of death. And that's difficult, you know.
That's hard. That's a real shame. That's tough for everybody.
Right.
Katie, is there any way, as we wrap this up, is there any way, if anyone had any questions for you or wanted to reach out to you, is there a way they could reach you?
They can always email me at Barnes. It's katie.islam@barneshc.com. Or you can call the main line at Barnes and ask for me, and they'll transfer.
Awesome. Well, great. All right. Well, and again, I'm Charlie Barnes the Fourth. You can also reach out to me if you had have any questions at charlie4@barneshc.com. Follow us on social media. Follow hashtag Hometown Healthcare, Facebook, LinkedIn, etc. Again, thank you for tuning in to our Hometown Healthcare episode. Take care.